Our next speaker is Liz Wynot. She is Director of Harm Reduction Programming at Tapestry Health, which has offices throughout Western Massachusetts.
So hi, everybody. My name is Liz Wynot. I'm the Director of Harm Reduction Programming at Tapestry. And our Harm Reduction department at Tapestry, we have syringe service programs all over Western Mass. And we primarily work with people who use drugs and aren't ready to stop using. My presentation today is I'm going to talk about harm reduction, and I really actually want to focus in on the supplies that we give out and talk about harm reduction in that context. Seeing that this conference is mainly for medical providers, I thought it useful to talk about the supplies and the harm reduction and just kind of talk a little bit through about the way that people inject drugs in order to educate you as providers on some harm reduction tips and techniques and things that you could possibly talk about with the people that you see in the hospital setting. So the first thing I just wanted to say is that the principles of harm reduction fall into different categories. Basically, how I like to think about harm reduction is that we really try to meet people where they are at and not where we want them or wish that they would be. Harm reduction really tries to see things as they are, meaning that although we wish people would stop using drugs and that the issues related to drug use and overdose didn't exist, they do. And it's important and necessary to really focus in on how to reduce the harm centered in drug use. Harm reduction believes that the person, particularly in this case, the person using drugs, is very well equipped to make healthy decisions for themselves. And it's really important to involve them in the discussion and decision making regarding their life. So I think that one of the biases or maybe misconceptions that may exist in the society that often deals with drug use is that people who use drugs can't make choices and may be driven by their drug use and not be able to control themselves. However, we found that, through working with drugs that people are able to make decisions for themselves. And it's really, I guess, important and necessary to kind of listen to people and try to, sit down and work with them from wherever that they're at. At Tapestry, we provide a variety of services. As you see here, we have two. I took a lot of photos off of our website recently, and because of COVID, we're all wearing masks now. Since March, a lot of our services have moved outside and through outreach settings. And so, in the past few months, we've altered our services, but still have stayed open and done what we can. So we, in addition to the harm reduction programs that I oversee, we also have sexual and reproductive health clinics located all over Western Mass, and we have WIC programs located in Springfield and West Springfield. And on the right, you'll see the bubbles that luckily we received a small grant to provide vaccinations for hepatitis A and B these past few months. And we collaborated with a wonderful nurse, Kim Dion, who's sitting in the upper right corner, and her, as well as another nurse, Jess Holden, they provided hundreds and hundreds of vaccinations for hepatitis A and B to homeless folks who are currently using drugs in the Holyoke and Springfield area. And then we also have our staff, Chloe and Gabe, in these photos who have been there to provide particularly a lot of education related to injection drug use and Narcan. So what I wanted to do today was to go over the common supplies that we give out. When thinking about people who inject drugs, we often try to when thinking about how to kind of educate and talk to people, it's really important to think of the access that people have, and think about it like, in addition to the behaviors, it's important to think, I guess, about setting. So when it comes to heroin injection, there's a lot of different items that are involved to safely inject. Heroin in particular, in Western Mass, and it comes in powder form. You need to dissolve that powder in a liquid, and then you need to basically draw it up into a syringe and obviously inject it into your skin. There's a lot of opportunity for infection, and just a lot of opportunity for risk. Now, people who use drugs are one of the most stigmatized and isolated populations that exist. And that means that when it comes to drug use, it's often very secret, and it's not something that has a lot of opportunities for education, for safer use in order to prevent things like hepatitis C and HIV and abscesses and other skin infections related to injection. So one of the very basic things that we do is we educate people around how these items on the screen help to prevent infections and transmission of HIV and hepatitis C. So I'm going to go through some of these one by one. The first thing is the syringe. So at Tapestry, we really want people to use one syringe every time they inject. And a powerful visual that we have in our waiting, or our what we call the exchange rooms, which is where we do our counseling sessions, is this. And I really like showing this to people to demonstrate how quickly a needle becomes barbed. Now, it's also important to mention that up until 2012, Northampton was the only needle exchange that existed west of Boston. And it wasn't until 2007, I believe, that it became legal to purchase and carry a syringe without a prescription. We just opened our Springfield needle exchange. We're going on 2 years now. And then our other programs in Greenfield, North Adams, Chicopee, and Holyoke have only been open from months, a year. Our most recent site was Chicopee, and then we've only been open years. So when we think about access to unused sterile syringes, they need to be more available. And I think this image really demonstrates why. One important thing to say is that I'm assuming that most of us on this presentation are aware of the increase in fentanyl in our drug supply. Fentanyl has really caused chaos and really it's really poisoned our drug supply, and it's been damaging for multiple reasons. But one thing is that with fentanyl, the high doesn't last as long. So within the past few years, a few years ago, before fentanyl became really present in Western Mass, the average amount of injection for heroin use, just the average, was about 3 to 4 times a day. Now with fentanyl, it's about 5 to 6 times a day. So when thinking about that, if someone uses the same needle multiple times a day, and in one day, their needle can look like the lower right corner on this image. Now, these are some of the other supplies that we give out. We give out what we call a cooker. I also hope that we all know that hepatitis C can live on surfaces for days to weeks. And it's what we really educate people on the importance of keeping their supplies related to injection to themselves, basically, and not to share. So we give out sterile cookers to help to allow people to do that, and we educate people about hepatitis C, and HIV, of course, and other infections. In addition to a cooker, which is what you would put the heroin in, you also need a filter, which you would stick the syringe into to draw the drug up into the needle. Now, these little cotton pellets on the screen are what we give out. There's a hierarchy of risk when it comes to a lot of the supplies, and with cotton, we still come across people who use filters like a cigarette butt, or don't use the filter at all. So a cigarette filter has a lot of chemicals in it that can be very damaging to the person who's injecting drugs. And so when sitting down with a person and kind of educating, we like to get a sense of like, what's their background, where they inject. For example, are they homeless? Do they inject outside? Do they have access to supplies? What are they using for their supplies? And it's pretty amazing that still, when talking to people, like how much misinformation is out there. So as medical professionals, I just think that there's like a lot of opportunity to apply the kind of basic medical understanding of disease transmission and apply it to these supplies. In addition to the filter and the cooker, you also need water. And then in these next slides, sorry that this is a little bit blurry, but again, this is the hierarchy of risk when it comes to water. And this is another thing that we talk a lot about with people. So we work with, again, a lot of people who don't have consistent access to housing. And with that and the lack of access to clean water, it's just, I guess, really important to take into all possibilities with the individual and talk it through with them to get a sense of just basically like how to reduce that risk in that moment. So at our sites, we give out these pink and red one-use ampules, and these are, again, for one use. So another, I think, common option that I've seen in harm reduction kits are little bottles of water, and those are fine too. But like with the little bottles of water, we really educate people on how bacteria can be introduced into that water really easily, and if it sits around for a while, especially. And then also, depending on who the person may live with or use with or be around in a drug using setting, it's possible, much easier for things to get shared unintentionally and for things like HIV and Hep C to spread. In addition to this, we give out alcohol swabs, and we teach people about swabbing in one direction, allowing the skin to dry naturally. It's very common. I think I've seen a lot of people who will wipe the alcohol after injection, and that's not necessarily good for the skin. So there's just a lot of opportunity around that for education that we found. We give out lots of hand sanitizer, and luckily we've been able to have a steady access to hand sanitizer after COVID. We work, so crack cocaine is a very common drug in Western, and focusing on the Western Mass. A lot of people consume crack, and a lot of people inject crack. To inject crack, you need an acid to break it down into injectable form. And people will often use something like vinegar or lemon juice. Vinegar and lemon juice can be very, very damaging to the person. Any acid introduced into the person's system is not good, but coming from a harm reduction perspective, vitamin C is the safest alternative. It's much safer than lemon juice or vinegar. So we also make sure to carry this on our sites and give it out to people who do inject that drug. We give out these AK wipes. We give out tourniquets. And with tourniquets, we do talk a lot about like how to tie a tourniquet, like tie it the right way, to tie it in a bow instead of like a shoelace or, whatever, the other way. and we talk through the process sometimes with people about releasing the tourniquet before fully injecting. And I think that's also when thinking about like as a medical professional drawing someone's blood, we educate people through those same steps. As particularly with fentanyl now, a lot of overdoses are happening much quicker and stronger. So whereas with a typical heroin overdose, the actual the actual time from injection to overdose average was about 30 to 90 minutes. And now with fentanyl, people are falling out immediately as they're injecting. So if that happens, having a tourniquet around the person's arm, if they pass out, isn't good for obvious reasons. We also give out Band-Aids and we give out ointment to help with the healing time. And we give out a lot of wound care kits. So the most common, as harm reduction counselors, and we aren't medical professionals, the most common, I think, things that we see is wounds, untreated wounds, and hepatitis C. We deal, and I'm sure a lot of you are very familiar with this, is we deal with a lot of people that aren't willing to go to the doctor to access help for their wounds. And, people who use drugs have a long history of feeling ashamed about their drug use. And the shame, that internalized shame, often results in not accessing the help, the care, the treatment that is needed. So to help with that, when people will not go to a doctor, we provide these wound care kits and provide basic education about how to tend to a wound. And then we also provide sharps kits. We like the black ones, we call them fit packs. They can fit in like a back pocket. They're really small and really easy to carry around. This last slide that I have, these blurry images, I just took these off of the internet. I went on to try to find some images of people injecting. It was actually it was really hard to find images that reflect how injecting really looks. So I just found these because I think that these illustrate a little bit of what I've talked about. On the right, as you can see, the tourniquet that's wrapped around, or the thing that's used as a tourniquet that's wrapped around the person's arm, could be very harmful if the person passed out. So, and also that looks like it could be old. It could have a lot of bacteria on it. It could be used. So that's why we provide tourniquets like the rubber ones. In the bottom left corner, I don't know why that needle is trying to drop liquid without a filter. So that's I think an inaccurate picture. But as you see, the filter is on the wooden table. That wooden table could be, the place where people sit around to use drugs. It probably has a lot of bacteria on it. Could have hepatitis C contamination on it. That cotton could have been used by someone else and have HIV. So there's just so many routes, opportunities for infection. And then the upper left-hand corner, I think this was some documentary in Australia, but I just thought it kind of showed, again, we work with a lot of homeless folks, and a lot of people do rely on abandoned buildings as their home, and also as their main place for injecting. So I just thought the upper left corner, that looks like a plastic spoon. That looks like a place where a lot of people use, as it's very dirty, the table, the place, and we want that person, whoever's injecting in that place, we want that person to be as safe and as basically as humanly possible. So again, bringing it back to harm reduction and really working with the person where they're at. We want to work with that person who's squatting, in that abandoned building, and make that connection. Because also when it comes to trying to, meet that person where they're at and really trying to understand them, and not necessarily like talking about possible or pushing them, having an agenda of basically trying to get them to do things that they aren't ready for, that helps a lot with building trust and building a relationship. And that trust and relationship, that is really where the change comes. And so there's so much opportunity in that moment to, I think, make immediate change in terms of like educating them about safer use. But then it's just that basic human connection, and really like letting the person know that you don't think you're just trying not to shame the person, or just being aware of our language and things like that. It goes so far with helping people in their time of need. So I really appreciate everyone who's been on this webinar, and thank you so much. It's really great to be here. Thanks.
I want to take this time, Liz, to thank you for that lecture. I think it holds an incredible amount of valuable information that sometimes we don't think about as medical providers. And I have a few questions from the group that kind of came up. We talked a lot about preventing infection and how important that is. I wonder, do you have any tips for folks to think about how they prevent overdose if they decide to keep using drugs?
Yeah. Well, I think, yeah, I do. And this actually could be a really long conversation and a presentation in itself. But when we do education around this, we talk about how to prevent an overdose. We talk about tolerance. So has the person been abstinent from heroin or whatever drug? And are they returning to use? Have they just started using? And then we also talk about mixing drugs. So, a lot of people will mix things like cocaine with heroin, alcohol with heroin possibly, and benzodiazepines with heroin, just for example. And those alcohol, cocaine, and benzos have effects on the potential for overdosing. And we talk a lot actually about benzodiazepines and how they just have this kind of synergistic effect with opioids. And when we talk about benzos or any other drug, we don't necessarily focus in on not using, but we try to have a conversation related to how that individual uses. So it's just really trying to talk to the person and trying to understand how that drug may impact the body and taking it from there. And then another thing that we often talk about is the importance of not using alone, which of course is very difficult because, again, with people with drug use comes a lot of shame, stigma, and isolation. I often say if the person is using in a bathroom or a setting, like, can you keep the door unlocked? If you are injecting in a bathroom, like, try not to lean against the door. Is there anybody that knows where you are? There are some apps available. There's one app called, I think it's called Canary. And then I know that some other apps are being developed, but just even people put like a timer on their phone so the alarm will go off. And then if they don't hear the alarm, it's possible somebody else will hear them. So it's little things like that, and trying to like support the individual.
That's great. In thinking about in thinking about our healthcare group here, I think oftentimes we're confronted with a lack of time where we may only have a few minutes to talk to patients about this. What would you recommend for that? If really you only have a few minutes to talk, how do you approach that?
Yeah, I mean, I imagine if someone's coming into a medical setting, they already have something going on. So I'm sure that there's a lot to talk about. Tapestry, our syringe access programs, we do have sites all over Western Mass. So I think really trying to give out the information and referral to come to a needle exchange or a site where basically there's harm reduction counselors that can take more time to connect with that person. I think that's really important. In a 2-minute setting, I think it's difficult to say what to talk about, but I think a lot more has to do with how to talk to a person. I actually often identify as a person with lived experience, and I have a history of using heroin myself. And I remember when I was in the throes of that, and when I interacted with medical professionals or other people, I remember next to nothing of what they said to me, but I really remember how they made me feel. And that's what sticks with me, and I think that's what sticks with the person. And I think it's really trying to focus in on how to be kind, and just trying to connect. That will go a long way with people who use drugs.
Thank you for that. I think that probably is the statement of the conference, that connecting with folks and treating them as people and treating them as you would want to be treated is a really important. For those folks that we do refer to Tapestry, when they go in, what can we tell them to expect when they go into a Tapestry site?
So our all of the like what we call the needle exchange, and then the Narcan education and distribution is anonymous. So when people come in, they don't give us any identifying information. With COVID, it's a little bit different in terms of our education and exchanges is in the more waiting room area, but it's a private space where the person will ask basic questions. When the first time someone comes in, we try to bring them to a private space, and we try to have a conversation with them to assess their drug use and their sexual risk history, and take it from there with the conversation. But at minimum, we just take information, and we record demographics to keep track of services, and then they can just expect to receive any type of education or supplies, and the staff member that they interact with will give them a description of what types of supplies that they can give, and then take it from there. We really will try to engage the person to get Narcan, and then also to engage in things like testing and counseling for HIV, Hep C, and STIs. And then if the counselor does see that the person is interested in substance use treatment, they'll do a supported referral for further care. But at minimum, you can just expect a staff person who's non-judgmental and kind, and someone that won't judge you for coming through the door, and you can expect to not have to give your name or anything else.
Well, I really appreciate it. Thank you for the time today, and thank you for the amazing work that you and everyone else at Tapestry does.
Yeah, thank you. Thanks for having me.
Key points from Liz's lecture. Harm reduction is the idea of treating the person at whatever stage of recovery they may be in, not where you want them to be. Teaching the steps to prevent infection and overdose can save your patient's life and can help to build the trust in the healthcare system. Tapestry is available throughout Western Massachusetts to help provide harm reduction resources and training.